Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas.
Hello, everybody. It is Tim Cranton from the College of Remote and Offshore Medicine with our podcast. And today I'm going to be talking to you about rabies. You might wonder why. So I am a graduate of the London School of Hygiene and Tropical Medicine, and I did the diploma in tropical nursing. And one of the things that we studied was neglected tropical disease amongst other diseases, but rabies comes in that list. Anyway, to cut a long story short, not only am I a graduate of this particular course, but I have a vested interest in that I was involved in an incident in India whilst my wife and I were traveling, where I was actually bitten by a dog that was suspected of having rabies. It was not a nice experience, and there are a lot of things that I obviously had to go through, and one of those was the worry of actually having the disease itself. And if anybody knows anything about the disease, once you have rabies, there is no cure. And really the only cure is death, and that's what it leads to. So I'm going to discuss the subject of rabies, and one of the things that I asked during my course at London School of Hygiene is rabies adequately controlled worldwide? And based on my experience, despite all of the evidence to maybe suggest that it is or it should be, I've come to the conclusion that I think we could be a lot better in terms of control, and maybe if that control had been in place, I wouldn't have actually ended up getting bitten. And this is also, information for any of you out there who are thinking of traveling around the Far East, traveling around Asia and India, where there is a significant risk of this disease. And I think it's something that should be shared, and something especially travelers or those of you that are working in remote healthcare locations should be aware of. And it may give you an idea of how you might be able to manage any situation that does arise where rabies could be involved. So, according for the Center for Disease Control, that's the CDC as we know it, rabies is a fatal disease, and it's estimated to cause approximately 59,000 deaths worldwide. That's now. Dog rabies is common in many countries, and it's still the cause of over 90% of human exposures to the disease, and it's responsible for 99% of rabies deaths worldwide. Now, that was according to the CDC. I think my records have got 2021. So it's a couple of years ago now, but now we have to think about COVID. And again, I'll get to that and the possible influences that had in terms of control of this disease. Unfortunately, there appear to be concerning discrepancies, though, and deficiencies with regards to reporting rabies. Now, the World Health Organization, the WHO, and World Organization for Animal Health, their data shows that information is frequently missing for at least 1 or 2 years, maybe more, in several countries. And additionally, rabies is classified as a neglected tropical disease, which is what I've already mentioned. And despite vaccination and control measures being readily available, we are still suffering the continuing burden of dog rabies. So for myself, who's currently studying a master's in global health, again, this is one of those things that is of interest for me, because I'm wanting to know, why are we still, despite the fact we might have the tools to be able to deal with these things, why are we still having problems? Now, rabies is defined as progressive encephalomyelitis. That's a difficult one to pronounce. And it's caused by the neurotrophic virus rhabdoviridae of the genus Lyssavirus. So this causative agent's been found in developing countries in all continents where dogs are the main reservoir, excluding Antarctica. Now, for myself, as I mentioned, whilst traveling through India in November 2018, I was actually bitten by a dog suspected of having rabies. So obviously I've got first-hand experience with the uncertainty of contracting this disease. And it's a dark shadow that hangs over you for a long time. It's a little bit like getting a needle stick injury, I guess, in a hospital where there's disease, and then having to go through the worry of maybe you've contracted that. So whilst post-exposure prophylaxis, or commonly known as PEP, was provided, the local authorities were not interested in raising a police report. They were not interested, to attempt to trace the animals involved, as this would possibly compromise the funding of canine rabies vaccination and neutering by local expatriates. So that the area that I was staying, it was actually in Goa, and we know that there have been particular issues in Goa with regards to rabies. And we also have to understand that there is a tourist industry. And if there was anything that could possibly put people off from traveling to those areas, maybe they might want to keep these things quiet. And one of the things I did learn during the course of my own investigations whilst I was there was that it was actually expatriates that were funding rabies vaccination and neutering programs in this particular area. I thought it would have been done by the local authorities, the local health authority, but it turns out that it wasn't. One of the things I certainly looked at when I went into this deeper, especially when I was on my course, I wanted to look at the adequacy of rabies disease control. And I wanted to look at where those inadequacies lie, because it was obviously obvious to me that, especially through my own experience, that there seemed to be a reluctance to even want to recognize that there was a problem, for fear of losing money through tourism. Now, that aside, let's look at rabies itself in terms of prevention. So it's 100% preventable. That's supported by history and research that's led to the availability of highly effective prophylaxis. As far back as 1804, a gentleman called George Zinker demonstrated that rabies is transmitted in saliva. And he did that by injecting animals with the saliva from a rabid dog. Consequently, Louis Pasteur developed the first, what we would describe as attenuated vaccine. So that's a vaccine that contains whole bacteria or virus which have been weakened, or diluted for want of a word, such that it creates a protective immune response but does not cause the disease itself. 9-year-old Joseph Meister, one of the first recipients of what we would now call post-exposure prophylaxis, had been attacked and bitten by a rabid dog, and he became the first person to receive, arguably, the rabies vaccine. And since it has saved and saved so many lives and prevented the disease from being transmitted. He survived. Joseph Meister survived. And furthermore, in 1889, so more dates for you, a gentleman called Victor Babish added to Pasteur's achievements by introducing simultaneous administration of a serum with rabies antibodies and vaccine as a method of post-exposure prophylaxis. So we have tools, and we have a very effective tool as far as vaccine goes. So if we think about control, elimination and eradication is obviously what we're looking at. And these are terms that are frequently used when we attempt to rid the world of a disease process. Obviously, there are many diseases. I'm not going to go into all of the neglected tropical diseases right now. But when discussing control, we should understand that these terms have specific criteria. And they include socioeconomic impact on disease prevention and influence a reluctance to participate in such incentives, especially where cost, time, and effort involving the local populace are involved. So this is definitely something, during my research, that this is something I looked at, and this is something I found. And not only did I find, I experienced as well. Now, the overall goal of elimination and eradication is to reduce the incidence of a disease to zero. That's what we want. We don't want the disease. And by definition, eradication means globally and permanently. Elimination seeks to do the same, but it's reduced to geographical zones and does not need to be permanent. Specific modalities I've made a list of, and these determine whether any of the associated goals can be achieved. Now we split these into what we call biological and socio-political criteria. So our biological criteria state a vaccine or drug treatment must be available as an effective intervention. Diagnosis must be effective and accurate, and there must be an absence of environmental or animal host reservoirs. This is what we're looking for or looking at when we're looking to eliminate and eradicate. Sociopolitical criteria include eradication needs to be widely perceived to be worthy. So in other words, is it worth the effort? Being technically feasible and effective in a geographical region. Well, it should be, especially if we've got the tools for the job. And there must be a political commitment that's obtained at the highest level with a World Health Assembly resolution. There must be an advocacy plan, and that would need to be at the global, regional, and national levels for it to work. Obviously, there are people that have written many papers on these things. Bodemede in 2019 wrote one of those papers, and whilst he recognized the need for criteria to define the terms elimination and eradication of neglected tropical diseases, what he did was he missed out on further criteria, either under a socio-political heading or using a new heading, socio-economic. And the means to eliminate rabies with effective pre- and post-prophylactic treatment are available. However, and this was something that I kind of noticed, that priorities need to be placed on essential services and the treatment and prevention of other diseases. And you can probably see where I'm going here, especially when I mentioned COVID-19 earlier on. Now, rabies management may not be defined as essential. So despite the fact that it kills 59,000 people, a year, it still may not be seen as essential in a particular area of the world in terms of its control, management, elimination, eradication. And prior to September of 2021, rabies was not a notifiable disease in India. So that was a real surprise when I came up with that one. And again, that was referenced in more than one paper. And we also need the full cooperation of local authorities to reinforce things like policies and to build an engaged society. And of course, we need the finance to support it. As I already mentioned, especially in places like Goa, there's a well-established ecotourism industry that can provide considerable wealth to the developing world. And anything that can potentially stop tourists from visiting an area, especially with the threat of contracting a killer disease, may drive the recognition of a problem underground and lead to the level of underreporting that the World Health Organization has already recognized. When I reviewed the World Health Organization data, it was apparent that rabies data is significantly underreported. And a neglected tropical disease is described as a group of diseases that impacts more than 1 billion people globally. So for any of you out there, that didn't know what a neglected tropical disease was, it's described as a group of diseases that impacts more than 1 billion people globally on an annual basis. Most prevalent in tropical and subtropical countries, they occur in approximately 149 countries and specifically in underdeveloped areas. And of course, these areas may be areas that we may end up working in as remote healthcare practitioners. They are overwhelming to the economy and that results in trapping the poor into a cycle of poverty and disease. So what we're seeing here is an emphasis more on the economics than the politics. Therefore, the adequacies of controls should center around the economic impact, and they need to move away from poverty rather than geopolitical impact. Now, it's been suggested in research that the reason why the incidence of rabies has not declined is due to a lack of or a general lack of awareness. And that's amongst policymakers regarding the actual disease burden. Remember, I said already that there are issues in terms of reporting and underreporting that's already been recognized by the WHO, and the need for prioritizing resources towards its control. However, government ministries still need to recognize roles and responsibilities as well as allocating budgets across their organizations. And there have been significant challenges with this over the past 125 years. This is nothing new in terms of disease control and disease management worldwide. If any of you are interested, there is a really good publication out there, the Open Science platform, Frontiers in Veterinary Science. You might think, well, what's this got to do with animals? Stick with me and I'll explain. So this particular article, publication, published an opinion article in 2022, so it's not that long ago, explaining a continued inadequacy in terms of elimination through a failure to embrace what we would describe as the One Health concept, and especially in Asia and Africa. So this neglect of neglected tropical diseases was identified in 2020 when no disease identified under this list represented a global priority in terms of numbers of people affected or what we describe as disability-adjusted life years lost. Now, the Centre for Disease Control plays a significant role in monitoring all disease globally and obviously the impact of these diseases, especially rabies. The knowledge of the disease and its global impact is well understood, and within the Centre for Disease Control, the poxvirus and rabies branch conducts annual assessments of individual countries' rabies status worldwide. And it's the responsibility of actually two programs within the CDC, Travelers Health and the Animal Products Importation Program, to monitor this. So the CDC is actually the primary organization that assesses rabies status by country, and it states that surveillance to determine elimination success is robust if formal reports are available. Now, a robust control program for canine rabies is evidenced by control measures that include dog vaccination coverage with a significant reduction in cases. Now, one of the things I found, again, after the incident I was involved in, I ended up trying to find where these dogs come from and did anybody know about them. And I was actually able to get hold of some of the expats who gave me some really valuable information in terms of how many dogs had been vaccinated. And one of the ways that you could tell was if they had a tag or if they'd actually had a cut made in their ear. And you could see that if especially with the male dogs, they would have been neutered, but also vaccinated, and this was demonstrated by a cut in their ear. Unfortunately, during my incident, I could see neither, and that was my biggest concern because I was being told, well, you should be able to recognize it because the animal would have had its ears cut, or it would have had a tag that you would have seen, and I didn't see anything like that. So as you can imagine, there was obvious concern. And in addition, the assessment considers wildlife rabies and canine rabies variant and non-rabies lessiviruses. So this is all considered in terms of rabies. It's not just canine rabies, it's also wildlife rabies that the CDC is concerned about. Where 70% of dogs are vaccinated, scientists have shown that the disease can be successfully controlled and human deaths prevented. And Wallace wrote about this in 2017. So I mentioned One Health before, and this is actually quite an interesting thing, especially when it comes to having come, or certainly the article that I read recently and wrote about, that it come from a veterinarian publication. So, One Health is defined by the One Health Initiative Task Force as the collaborative efforts of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and our environment. In fact, there was a task force that was put together in 2008 to try and achieve this. However, the concept of One Health, so that's everybody, people, animals, and environment, is not new. Now, a veterinarian, Calvin Schwab, he coined the term One Medicine in a medical textbook. That's Veterinary Medicine and Human Health. Any of you want to go and look that one up? Published in 1964, so it's a few years ago now, and reflecting the similarities between animal and human medicine. He stressed the necessity for physicians and veterinarians to collaborate and help solve global health problems. It makes sense, especially where we have animals as vectors for human disease. With the assistance of the University of California, he was able to form a department to address challenges facing animal and human health sciences globally, and they did that together jointly. So the concept of One Health was further developed. So in 2004, the Wildlife Conservation Society, so this was during a conference in New York, created the 12 what we call Manhattan Principles that describe a unified approach to the prevention of epidemic disease and One Health. Numerous global entities adopted these principles. So coming kind of more to date in 2019, they were updated as the Berlin Principles. So again, if you want to go and look that one up. And it was felt that One Health narrowly focused on selected topics. So emergent infectious disease relationships between humans and animals and pandemic preparedness. So as it was a constrained approach, it would not deliver what was described as a full global health potential. There are 10 principles, and they are quite detailed and they're extensive. So I don't really want to go through them individually, but I've picked out a few just so you've got an idea of these Berlin principles. So one of those is to devise adaptive, holistic, and forward-looking approaches to the detection, prevention, monitoring, control, and mitigation of emerging, resurging diseases and exacerbating communicable and non-communicable disease that incorporate the complex interconnections amongst species, ecosystems, and human society, while accounting fully for harmful economic drivers and perverse subsidies. So a bit of a mouthful, but we have to have the means. We have to be able to detect. We have to be able to prevent. But in order to prevent, we need to monitor and we need to maintain control. So as you can see, this is not necessarily an easy thing to do. It's actually quite complex. We also need to form participatory, collaborative relationships amongst governments. Remember, again, at the beginning, I mentioned about incentives need to be or come from a much higher level, especially when it comes to financing those incentives. But working together with NGOs, indigenous peoples, and local communities while strengthening the public sector to meet the challenges of global health and biodiversity conservation. And especially for myself, when I was speaking to kind of local nationals in Goa, they seemed to know more about it in terms of kind of what they could do to prevent it, but they couldn't necessarily afford vaccination. And in terms of access to PEP, it was kind of easier said than done. So really, they just got on with their lives and they weren't going to do anything any different than what they already did, unless somebody else from a kind of a government level or an NGO was going to finance it or give them the means to be able to do something about it. Obviously, we need to invest in education, and this is why I think this is an important thing to share with our listeners, and raise awareness for global citizenship and holistic planetary health approaches amongst children and adults in schools. If we teach our kids, especially when it comes to things like first aid, I think that's a really important thing to do. But we should also be teaching them about disease as well, and especially about the prevention and control. So, as I said, approaches amongst children, adults in schools, communities, and universities. But we also need to influence policy processes to increase recognition that human health ultimately depends on ecosystem integrity and a healthy planet. So, if we consider the One Health approach, we must also recognize the impact that I've already mentioned COVID-19 has had on attempts to eliminate neglected tropical diseases. A lot of people, were affected by COVID-19, especially when it came to lockdowns. People may have lost their jobs as a result. Unfortunately, some people lost their lives. And it was seen globally as a priority. But unfortunately, there are other diseases statistically kill more people than unfortunately COVID-19 did. And we have evidence that tells us this. And I'm not saying that we should ignore COVID-19. Definitely not. Because we know it's a disease that can kill people. But there are also other diseases out there. So in terms of our priorities, arguably COVID-19 was a disease that affected the Western world more than arguably it did indigenous cultures and peoples in Asia, in Africa, in South America, for instance. And there was definitely vaccine inequality when it came to access, like the COVID-19 vaccine for people from those countries. And the pandemic has had no attempts to eliminate neglected tropical diseases, and that included rabies. So due to restrictions implemented to limit and stop the spread of SARS-CoV-2 and redirection of funding, vital management activities were drastically limited or even stopped. So mass dog vaccination alongside surveillance for rabid dogs had no longer been prioritized. And there are significant concerns that we will see an increased global rabies burden in the coming months and years. And actually, this is what we're looking at now. And if control efforts are being further delayed, diminished, or suspended, things could get an awful lot worse. Now, commitment was made internationally. So goals and intentions as far as the WHO and the CDC are concerned, a target of 0 human deaths from transmitted canine rabies has been set for 2030. So based on everything that I've kind of just talked about in terms of COVID-19 and neglect in terms of actually looking at NTDs, are we really going to be in a place where we can be ready for that target 0? We know it's feasible. It's been demonstrated in several countries and regions that the necessary tools are available. And the Lancet, there are several papers that talk about this. And this plan, described as ambitious, details the changes needed to be made in society to meet this goal. Furthermore, it shares responsibility for its implementation across affected countries. And obviously that includes partners and key stakeholders. So these 3 objectives, they state: to effectively use vaccines, medicines, tools, and technologies that will stop dog rabies transmission and reduce the risk of human rabies deaths; to generate evidence-based guidance and high-quality data. And this is something that we need with any disease. COVID-19, rabies, we need high-quality data to measure impact and inform policy decisions. And to harness multi-stakeholder engagement to sustain commitment and resources. And this is a big thing worldwide. Being able to sustain a program. Once you start, you need to be able to see it through. So, where are we now to date in terms of control and being adequately implemented on a global scale, especially after the SARS-CoV-2 pandemic? As mentioned, rabies is 100% preventable. But we also note that there are other challenges in maintaining the effectiveness of any initiated program. And whilst it's been proven that elimination of rabies is possible, rabies deaths are not being prevented effectively. A paper, this is Harish and Tiwari et al., so 2021, they set out a timeline in their paper, Eliminating Dog-Mediated Rabies, Challenges and Strategies, which identifies a prolonged battle in the attempt to eliminate this disease despite having the tools for the job. Now, as mentioned, COVID-19 hugely impacted the ability to maintain momentum and set back related goals that we'd established in 2015 to eliminate transmitted canine rabies by 2030. And we should also note that the One Health policy also covers future pandemic preparedness alongside designing other control and prevention categories. So COVID-19 is included in the One Health policy, or the likes of. And this creates an additional burden on the global health system. So priorities need to be set. In addition, health resources have necessarily been redeployed as COVID-19 has overwhelmed hospital capacities and budgets. And this affects the rabies workforce and finances as funds have been redirected towards pandemic efforts. Fundamentally, we appear to have several specific inadequacies when applying this One Health approach. Obviously, we need collaboration, and people need to be able to share. While sounding simple, each party is going to have its own ideas, have its own philosophies and priorities when utilizing resources and who should get what. We are used to working in a competitive culture. We worry that putting together our resources and taking a risk will ultimately lead us to loss. Also, people worry that they will be taken advantage of or overtaken by their performance. In order to work together cooperatively, more work is required to establish trust and for roles and responsibilities to be clearly defined. Organizations also have different methods and approaches, making identifying root problems and cooperation challenging. Factors specific to one country do not necessarily match others, so more time and investment are needed to identify general problems and issues. Ground rules have got to be established, most of all, agreed upon by all parties. For any of you that have ever worked in Asia, in the Middle East, in Africa, and we're trying to introduce any programs, if you've worked with an NGO, you have to have buy-in. You've got to have buy-in from, like I said, the stakeholders to ensure continuity. But it's also about the end user as well, and their cultural and civil normalities that must be integrated to bring together mutual understanding to enable continued collaborations and a lasting overall effect, which is obviously what we want if we're going to eradicate or eliminate a disease. Of course, we need to share data. And data's got to be shared amongst all sectors between regional and state governments and the global health organizations like the WHO, etc. We do not have the necessary information about vaccination statistics, confirmation of confirmed cases, so that's canine and human and dog population densities. We know that we're not getting the information we need. And we need further clarity on what constitutes intellectual property and ownership rights whilst maintaining data protection and privacy. So you would think that it wouldn't be a problem to share information on tropical diseases and the number of cases that we're getting in a specific area, and are we able to deal with them? But because we have these concerns when it comes to data protection, privacy, who owns what information, essentially this is stalling or preventing passing on good data so that we can learn from it and we can actually do something about it. Data also requires technology to facilitate sharing across organizations, and low and middle income countries may not have the resources to be able to manage this. It may literally be pen and paper. Again, in remote locations, you may not have good internet access or an adequate electrical supply where you can actually get data down onto a laptop or some kind of program, or being able to take ledgers and then transfer that somewhere into electronic records. And we also have this thing called asymptomatic phenomenon, where countries are making progress, they see a decrease in cases and deaths. And it's then harder for them to justify allocating more resources or continued resources, which would then eliminate rabies for good. Political will to eliminate rabies has to be addressed, in my personal opinion. Governments and local legislators need to recognize and construct a proper legal framework to allocate appropriate funds along with the resources that regulate vaccination and sterilization initiatives and other education programs for dog owners. Unfortunately, in places like India, there are a lot of wild dogs. And unfortunately, people that do own dogs, because there's no neutering or access to veterinary services is limited, those dogs also have an awful lot of puppies. And again, most of you that will have worked in remote locations, there are dogs everywhere. And whilst they play an important role, certainly when I was in South America, I was on a research site, and we had dogs because they were actually used to help keep wild pigs away from the campsite. So they were obviously a very useful tool in terms of keeping people safe. But in terms of their actual health and their health care, it was limited, or it just didn't exist. It's really important for pre- and post-exposure vaccines for both humans and dogs. Good quality data is needed to understand that, and that most human deaths occur at home because the disease is neglected. And again, it may go unreported, and when it is reported, unfortunately, it's too late. Both state and local leaders must be involved in any kind of management process. So in terms of COVID-19, well, now that we are on the path of recovery, the focus should revert to those neglected tropical diseases that are still and continue to take lives unnecessarily. So we need strategies for prevention and data collection that focus on maintaining social distancing, like canine rabies vaccination, are capable of surviving human lockdowns, as well as managing neglected pets that are allowed to wander unchecked. So, in conclusion, rabies kills, and it's still killing unnecessarily. Despite all the tools that are needed to eliminate the disease, we still seem to be failing on many levels. And that's primarily due to a lack of political will, the inappropriate allocation of resources, and a lack of legislation and enforcement encompassing mandatory compliance and public education. And again, this is where my interest lies. We really need, I feel, as healthcare professionals that work in remote healthcare locations, to be educating the people that we come into contact with about neglected tropical disease and neglected diseases. The methods to eliminate the diseases are adequate, especially rabies, and that means that rabies could be removed from that list of neglected tropical diseases. That's already been demonstrated in Western Europe, North America, Japan, and some Latin American countries through mass immunization of wildlife reservoirs. And the World Health Organization, again, they published a paper in 2019 that highlights that. Due to a lack of political will and the global impact of COVID-19, it appears that global control still remains inadequate and stalled, and rabies will likely remain an inadequately controlled disease for the foreseeable future. When I was bitten, my wife and I had just arrived at a resort, at a health retreat. The idea was we'd been traveling around India for several weeks, and we were looking for a place to chill out for a week, detox, relax, reset, and basically chill out. We were going to do some yoga. We were going to eat some fantastic vegetarian food, and relax and kind of come down from what had been a quite hectic agenda that we'd been following. So we literally arrived. We'd managed to meet the people that were in charge, and we literally dumped our rucksacks in the cabana. And I literally had my swim shorts on, and I just ran for the sea because it's the first time we'd been near any water, certainly water that was relatively clean, for a considerable period of time. And I just wanted to run into the sea and jump into the sea. And I got halfway down the beach, and my wife's behind me. And the next thing I know, there is a pack of dogs chasing me. So it literally just happened in an instant. Now, I had two choices. That was either run back the way I came or run into the sea. So I was, kind of halfway in between. Now, I know I can swim a lot faster than a dog, but I certainly know dogs can run a lot faster than I can. So the best option for me, in terms of my survival mode kicking in, was to head towards the sea. And as I turned to run towards the sea, I was actually bitten in the back of the leg by one of the dogs. I managed to turn round and shout very loudly. I think I managed to punch one of the dogs in the side of the head. As you can imagine, this is all happening in an instant. We're not talking one dog. We're talking 6, 7, 8 dogs, all in a frenzy. Quite possible that they were in a heightened state of excitement due to one of the bitches being on heat in this particular group. I was bitten twice. I was hit twice, quite hard, enough for me to be able to glance down and see blood on my left leg. And I ran as hard and as fast as I possibly could into the sea. Obviously, the dogs changed their mind because they realized they couldn't swim very well. And they carried on running up the beach, and they were kind of fighting amongst themselves. And my wife was behind me, and I kind of beckoned to her, don't come down to the beach. And this was a relatively secluded spot. There was hardly anybody there. I got in the water, I looked down at the wound, and I actually had 2 wounds, one on the side of my knee and kind of one on the back of my leg. One was kind of open, and I could see fatty tissue. And I'm in salt water. So what I did was I scrubbed and I scrubbed and I scrubbed and I scrubbed. So if you ever get anybody that's potentially bitten by a rabies vector, by a dog, it doesn't have to be by dogs, by the way. It can be raccoons. It can be cats. One of the last known recorded rabies cases that was led to the death of a foreigner. So when I say a foreigner, I mean somebody from, I think it was either the UK or America, was in Tunisia. It was actually in North Africa, and it was a scratch bite, or a cat scratch or a bite that had led to inoculation of the disease. So you must scrub the wound, and you are attempting to remove as much of anything that could be possibly related to the disease from the wound. And remember, a dog's mouth bite, it's not just rabies, there's a whole other load of bacteria there as well that you should be mindful of. So I spent a good 5, 10 minutes literally just scrubbing and rubbing my leg to make it bleed, to actively bleed as much as I possibly could. And when I felt that I'd done that, obviously I needed to be able to control the bleeding. So I ran back up to the beach. And one of the things I do as a remote healthcare practitioner who's also a traveler is I make sure that I package a really good aid kit. My wife, thankfully, she's a registered general nurse, an ex-military nurse as well, so she has a good idea of what to do. I explained everything that had happened and told her what I'd done already. And she obviously understood that we needed to be able to sterilize and disinfect the wound even more. What we managed to do is, from the resort staff, we got a bottle of Dettol. At the same time, I also called for the management of the location to discuss with them next steps. Because what I would need to do is go to a medical facility to get PEP, to get post-exposure prophylaxis. I got a bottle of Dettol. So any of you out there who know what Dettol is, it's an antiseptic. It's a very effective antiseptic. It can be used for sterilizing water sources as well. And I used that neat to a point where it actually started to cause irritation to my skin. But again, I scrubbed, and I probably scrubbed for a good 20, 30 minutes with the Dettol, making sure that I was irrigating the wound. Once I'd done that, I got a good dressing on it, and sterile dressing, and had arranged to get to local health facilities. Now, that in itself was a challenge. Again, they really didn't want to make any fuss. It was kind of like, well, it should be okay. You know, you look like you've done everything that you need to do it. It will probably be fine. But again, as a remote healthcare practitioner, I'm not going to put it to chance. So I got a taxi and I managed to get to a local health clinic that was actually closer to a hospital. And thankfully, I had a member of the resort with me, and he explained what had happened. And the doctor came out, and I think he thought maybe I was a local. But when he saw that I was a Westerner, he saw that I also had a bandage on my leg, and he said, "Well, you know, you've already been to hospital." I said, "No, I'm a remote healthcare practitioner. I know about the risk of rabies. I've already disinfected the wound as much as I possibly can, but I need to have post-exposure prophylaxis." And to be honest, his attitude changed in terms of he kind of realized who he was speaking with, and I got the post-exposure prophylaxis, or I most certainly got some serum, so that went into the wound. I actually got a tetanus inoculation, and I also had the first rabies PEP vaccination. Now, I've already had vaccination against rabies as a traveler, but at the time, I couldn't put an exact date on it, and it would have been within around 10 years or so. It was something that I didn't anticipate that I would need when I was traveling around India. So, in terms of my research, that could have been a lot more effective before I went. So, that's something for you guys to be aware of as travelers. And I had to then go because they didn't have enough vaccine. And when you take PEP, you actually need to take a series of vaccinations. So you've got usually day 1, day 2, day 5, day 10, day 15. I think I had 6 inoculations in all. And because we were continuing with our travel, then essentially every place that we stayed, we had to make sure they had a refrigerator and a little cool bag so that we could take my PEP with me, so that my wife could actually give me the injections at those different times. So you have to realize PEP is not just a one-off. You will need to take a series of injections. And this leads me to the last point. Despite all of that, potentially you could still develop the disease. Whilst it's still been proven to be extremely effective, there's always that air of doubt that kind of hangs over you. And again, you could argue that us as healthcare practitioners, we're arguably the worst when it comes to having, something wrong. If we have a pain, we're having a heart attack or something like that. So my concern was that I could still develop the disease, and symptoms of the disease may not show for up to a year, maybe 2 years afterwards. Now I'm looking at several years down the line now, thankfully. So it appears that everything worked and that the PEP was effective for me, and the measures that I took in terms of irrigating the wound and cleaning the wound were effective. Within 3-4 months after we returned from India, I got sick. I actually got back from a remote healthcare task, a job. And whilst I was on the job, I was on a ship, and we'd had some really bad weather, and I started feeling ill probably around the last week of the trip. There were delays getting off because the weather was so bad. And in fact, everybody was sick. So I just put it down to, a horrible bout of seasickness. And that in itself can be quite debilitating, maybe for a topic for another podcast. But I remember being sat at Heathrow Airport thinking, if I had a patient like this, I would be calling for an ambulance, or I would be the paramedic and I would be taking them to hospital. I have never felt so bad. I had, narrow vision, headache, nausea. I got home and I was very, very sick, just constant nausea, tunnel vision. And I honestly thought that that's it. This is the disease and it's going to kick in, and I'm 50 years of age, and this is how it all ends. Thankfully, through my wife, being extremely good when it comes to knowing about looking after our own selves, our immunity, using supplements to be able to boost my immunity, I got over it. But it took several months, probably 3-4 months of a very strict diet, taking vitamin supplements, intravenous vitamin C, and obviously painkillers. I think I was on diazepam at one stage because I just could not sleep, and it was a question of waiting. And my GP, my doctors, local doctors, put it down to my reaction to the culmination of vaccines that I'd had to have over that period of time. So that's one of the things we should also consider as well. You can have PEP, but the PEP may also have side effects. And those side effects, especially from an attenuated vaccine, may mimic the actual disease itself. And that was the process that I obviously experienced, and I would never wish that on anybody else. So, to make a summation of today's podcast, I want everybody to know about neglected tropical diseases. And if you don't know, or if it's a new thing for you, go and look it up, especially if you're going to be working in remote health, in remote locations as a remote healthcare practitioner worldwide. Educate yourself and educate those around you if you get the opportunity. Also, when you do your medical assessments, so your medical needs assessments prior to deploying to a certain country or a location, do your research. Do your research in terms of local disease and what measures are in place to be able to manage those, and make sure that you have the appropriate vaccines to protect yourself from endemic disease. So I hope you found today's podcast educational. Thank you for letting me share my experience with you. If any of you are interested in the London School of Hygiene and Tropical Medicine professional diploma in tropical nursing course. You will find them online. Failing that, you can drop me a line at t.cranton@corom.edu.mt, and I'll do my best to get the information out to you. Again, thank you very much for your time, and stay safe. Bye-bye for now.
This has been a presentation from the College of Remote and Offshore Medicine Foundation. If you would like to earn CPD credit for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credits, free access to the virtual field guide, and discounts on our e-learning courses. You can join the team on the college website, which is Corom, C-O-R-O-M, corom.org.